I'm Patrick Nolan. I'm the executive director of the union. I work on health benefits. Healthcare in New Jersey, in the United States, is designed to confuse, right? And to really not have you have good knowledge and access to your benefits. When you don't use your benefits, then lots of money is saved and made by the healthcare corporations and by the state of New Jersey, who provides this benefit. So this is really a benefit that the state of New Jersey provides, and we have it at Rutgers because Rutgers is the state university of New Jersey. And so that's key to know, and it's key to why, if you've gone through an orientation, TAGA orientation, new employee orientation, postdoc orientation, and they talk about health benefits, they don't say a lot, right? They may give you the basic information about how to enroll, where to enroll, and what your deadlines are. But we hear from our members all the time that there's no real deeper discussion about the differences between the plans and the costs of the plans. We're really here to present to you more information and help you make a more informed decision about what works for you and works for your family if you have a family that's supported by your health plan. We have some slides you can see. This is our second session. We have two more next week. If you feel like this is helpful in any way, you're welcome to come back next week. If you have follow-up questions, I put my email into the chat. You can send an email to me. You can reach out to Nusrat or Jacob if you have any follow-up on this or anything else. But also encourage your colleagues, right? If they're up against the deadline to register, please share the information with them. Okay. So here are some terms you may run into in healthcare. And I want to say that for especially those that aren't from New Jersey or not originally from the United States, you may be coming from a country where healthcare is much simpler. It's respected as a right, a human right. You have it, you just have it, and you go and get care when you need it. And there's not lots of forms, there's not enrollment processes, there's not deductibles, all of these terms here. You don't pay for healthcare in ways that you pay here. They don't try to confuse you to get you to not use the benefits. So these are just a few terms. If there's other terms that you have issues with trying to navigate, understand them, and you want to reach back out again, send an email, come to another session, ask the question at the end of this session. But these are some of the basic things. Copays is what you pay out of your pocket when you see a doctor or go to a hospital. So you're going to pay a contribution through payroll for your health plan. So you pick a plan in part based on those costs, and we're going to go over that. There's a calculator, and we have a few slides to show you the difference in cost. That's what you pay to be in the plan out of your paycheck over the course of the year. The copay is the additional thing. Lots of times the employers want these to be high because they want to impede you from using the benefits or quote unquote using too much of the benefits, right? That means that they don't make as much money. The copays, you'll see that if your contribution out of your paycheck is lower, then your copays might be higher compared to the other plans, and vice versa, right? So higher cost out of your paycheck buys you lower copays when you go see a doctor. And we'll go through the plans and compare them to paycheck deductions for the year with the calculator. It's another barrier to care, right? That's an amount of money you have to pay before your health benefits kick in. So you pay from your paycheck, and then you pay the deductible, and then you can have the health benefits. And so high deductible plans are out there. Those we discourage members from joining those because it's a lot of money you have to pay before you get any real benefits from your health plan. Individual responsibility requirement. We won't talk a little much about this. We don't see this a lot in our plan, but it's just there as another impediment. If you don't have minimum essential coverage, you may have to pay a penalty when you file your federal income tax return unless you qualify for a health coverage exemption. That means that you have to have a health plan. And at Rutgers, they should be requiring you to sign up for a health plan unless you present a waiver. And the waiver typically takes two forms. You're on your parents' health plan if you're young enough, if you're under the age of 26, or you're covered by another job or your spouse who either works here or somewhere else. And so you would file the waiver so you don't have to sign up for a plan and pay for a plan that you're not going to use. Maximum out-of-pocket limit, that's a protection built in so that of all the different copays and deductibles that you pay, once you meet that threshold, there's no more to pay out of pocket for you. It's there to make sure that if you have high healthcare plan cost in a given year, it's like a breaker in there. So it's a good thing to have a maximum out-of-pocket limit. so those costs don't keep rolling up because you happen to need to see doctors and go to hospitals on a regular basis. And again, there's all sorts of terminology that may not be clear to you, and you can always reach out and ask or ask during the session. Key dates to keep in mind. Again, we said if you're a TA or GA and you started on September 1, you have until September 21 to enroll. So that should have been covered in any orientations that you attended, but we want to make sure that you meet that deadline, because if you don't, then you fall into the 2-month or 60-day waiting period before your benefits become active. We don't want anybody to lose access to healthcare benefits. And open enrollment is important. It's a period every year where you can go in and make changes to your health plan. It's always in October. From October 1st to the 31st, the entire month, you can go into your portal and make changes. If you make a change, it becomes effective on January 1st. And the reason it's January 1st is because that's the new plan year. So the plan year for the state health benefits program is January 1 to December 31. Okay. If you've enrolled already in the plan, and like you're a new TA or GA, you've enrolled in the plan, and you see a doctor or have any other expenses in September or even in October, and you like just either hear something now or you have an experience with that plan, you can go in October and make another change to the plan. You should be able to make a change. If you run into a problem, let us know. But that's your window, right? Annually. So every October you can make changes, but they're not effective until the following January 1. So January 1 of 2025, that change will happen. Eligibility. Your commitment as a teaching assistant or a graduate assistant is 100% to the university, and it's full-time commitment to the university, not 100%. Full-time commitment to the university, because the union has fought, as Nusrath said, in our contract and in Trenton at the state capitol, to make sure that you're recognized as full-time employees for the purposes of these benefits. So your 15 hours a week that we negotiate and fight to limit in terms of the work that you're doing for the university is essentially combined with your studies, right? Your own research towards your PhD to make you full-time employees. And so that's something that the union has won for all Rutgers teaching assistants and graduate assistants. We're fighting to expand this to fellows, right? Because when you're on a fellowship, that is also work for the university. They benefit from the scholarship that you produce, the research that you do. But that's the next fight. But for now, TAs and GAs are considered full-time employees for this benefit. Some departments were trying to switch one semester, a fall semester only TA into the fellows plan, the student health plan. We got that reversed. We pushed back at the state level and at Rutgers and got that reversed. So they're all going to remain in the state plan. And that's important because the benefit level is very different. And if you've been a fellow, the difference, if you haven't been a fellow, you can talk to Nusrath and others who have been fellows. What we really want to do is prevent the back and forth where you have to switch out of the state plan into the student plan when you become a fellow. So that's the larger union campaign, is to fight for equity at your time here, because you don't always know when you're going to be moved from a TA to a fellow or to a GA. And so we want your benefits to be consistent all the way through your program. So what's key is that you're a TA, you start in September, your benefits run all the way through the following August. So you have 12 months of coverage, even though you're a 9-month employee. So you're on payroll for 10 months from beginning of September through the end of June. During the spring semester, you'll pay a little bit more for your benefits, your contribution. That covers July and August. So don't have any apprehension about utilizing your benefits or trying to switch to a different plan for July and August. You're going to have benefit coverage all the way through. Postdoc associates, you are considered state workers and you are considered full-time. And so you shouldn't have any issues about eligibility. Okay, so here's some of the important stuff. We're going to talk about a couple of the plans here in terms of these next two charts, next two slides, and then I'm going to show you like the breadth of plan options that you have. But we're going to key in really on 3 plans. The middle 2 columns, the 15 plan, we'll just call it the 15 plan. There are 2 providers for health benefits: Horizon Blue Cross Blue Shield of New Jersey and Aetna. Horizon is a New Jersey company. They have a network of doctors and hospitals and other providers here in New Jersey. They don't have provider network in other states. They use the Blue Cross Blue Shield in those states. So think about it as a patchwork of like 50 companies, one in each state, and they utilize each other's networks. So you have the benefit of that, but sometimes there's a little administrative hiccups or trouble because you're dealing with, for instance, Independence Blue Cross in Philadelphia or Empire Blue Cross Blue Shield in New York City. And so if you live outside of New Jersey, you shouldn't have a problem with the Horizon plans, but just know that you're really using your New York or your Philadelphia, Pennsylvania networks, and there's going to be some administrative back and forth between those companies, like behind the scenes. The Aetna isn't that truly like a national company, so it's one big network across the entire country. So a little bit less administrative red tape or bureaucracy on that side of it. Aetna is new as a provider to the plan. This is their first year. They just started. So they are a company, they're not a new company, and they've been a provider in the past in New Jersey, but they're newly entering. In some ways, you may get more attention, you may get more responsiveness from them because they want to recruit members into their plans and away from Horizon. The 15 is the plan that's been around forever, and most people are still in that plan. It's the most expensive plan, and it's expensive because you pay a percentage of the premium. The premium is the dollar value that the state puts on that plan in terms of what it's going to cost to cover you for the year. And it's not you individually, it's everybody in that plan. So it's people from Rutgers, NJIT, University Hospital, a whole bunch of local governments. And so they rate it out and they put a value on it. And that value then becomes you pay a percentage of that if you're in this plan. The plans to the right, the 1525, you'll see others that are 2030, 2035. They're just variations on that 15 plan. And they're a little less expensive, but you still pay a percentage of the premium. So they're high cost plans. The difference with the plan on the left, the ones that have 2019 in them, we'll just call them the 2019 plans. State workers negotiated that plan and they moved their members out of the 15 plan into the 2019 plan. And they got value in that because they switched their contributions from a percent of premium to a percentage of their salary. And that's always going to be a lower cost. And so they kept most of the components of the 15 plan, but they changed. So when they pay less out of their paycheck, I said this earlier, you're going to pay a little bit more out of your pocket. So you'll see that the specialist care copayment is $30 there instead of 15. So they changed that and moved that up. The emergency room payment is $150 instead of $100. And there's a $100 deductible. That's like per year. $100 is the first cost, and then everything's covered under the rest of the terms here. So those are the major differences. I'm trying to see if they have I don't see on here. I just wanted to just point out that there's certain things where you may see a specialist more often, right? So if you're in physical therapy, you may go on a weekly basis. Some people may go twice a week. Behavioral health, mental health therapist, right? You may see weekly or twice a week. So in those instances, you're going to do that calculation. You're going to see the difference between what comes out of your paycheck between these two plans, the 15 plan and the 2019 plan. And then you're going to look at what you might pay out of your pocket. So just in that instance, if you paid $30 instead of 15 and you had two specialist visits a week, that's $30 total more, and 50 weeks, that's $1,500 right there. And so if you paid less out of your paycheck, you want to see what the value is, what the difference is between that, what's coming out of your paycheck versus what might be coming out of your pocket. But again, your circumstances should dictate how you choose your plan. If you have a newborn child and you've maybe already been to the ER in the middle of the night and you may have some of those expenses, you're going to look at that difference between 100 and 150 and just think about that. You're going to do a bit of a calculation and see. If you have a chronic condition and you see a specialist on a regular basis, you're going to factor that in, the $15 versus $30. So again, the 15 plan, most people are still in that, but those are maybe mostly people that have been here for a while. And the costs for that plan are going to continue to rise. So next year, that plan will cost more by a double-digit increase. I think a 12 to 14% increase. The Direct 19 plan, 2019 plan, will have a much smaller increase because It's an increase to the percent of salary instead of the premium itself. This is another plan option. It's a tiered network plan. What it does is it takes the network on the plans before that we just showed and divides them up into tier one and tier two within the network. And these are the costs. Tier one, I'll give an example. If you're in New Brunswick or Highland Park or Piscataway, right? You don't expect to go far and wide for healthcare, right? You're okay going to Robert Wood Johnson Hospital in New Brunswick. You would see the doctors that are affiliated with the hospital. That's all going to be tier one for the Horizon Omnia plan. And so those costs will be $5, $20, $100, no in-network deductible. You could plan that out and say, I'm relatively healthy, or I would use all of those tier one providers. I'm not looking to go out of network because there's no out of network benefit for this plan. And you might say that works for me. If you're in Aetna, if you choose Aetna for tier one in New Brunswick, you'd have to go to St. Peter's Hospital. So just trying to give you that sense of under Horizon, Robert Wood Johnson is tier one, St. Peter's is tier two. For Aetna, they flip those two hospitals because they're trying to compete against each other. And so Aetna will call St. Peter's tier one and Robert Wood Johnson tier two. But otherwise, you're going to be able to find doctors that are tier one, or you're going to say, I'm okay with the tier two cost, right? And because I'm going to see less money come out of my paycheck. One added benefit to this plan is if you choose the plan within 3 months of enrolling, you should get a gift card for $1,000 that's yours to use. And when you see the plan cost, it actually would, for TAs and GAs at least, it would more than offset the cost of the plan for the year. The requirement is that you stay in the plan for a full year. And I think your September 1 to August 31 would fulfill that obligation. If the state's position was you had to be in for the plan year, which is all of 2025, then you'd have to be in for all of 2025 anyway. You can't make your change until next October, and it won't be effective until January of the following year. I think either way, the only thing that would disrupt that is if you change positions, say you went to fellowship next year. But we also think that you're covered on that because it's not your choice to move to fellow. And so you're not voluntarily leaving the health plan. You're changing position at the university by the university's direction. And so you're no longer eligible. So we don't think there really are scenarios where you would nullify the gift card, right? The incentive and have to pay anything back. Other employees may run into that, but we don't think that our TAGAs will have that problem. Okay. Do we have any questions in the chat?
I think I have a question.
Sure.
So I'm looking at the 10-month contract cost. Like when I'm going to enroll, it says 10-month contract cost, but like I'm supposed to be enrolled for like the 12 months in the plan. Can you explain a little bit?
Yeah, I think it's saying 10 months because you're on payroll for 10 months, right? September 1 to June 30th. And what Rutgers is going to do is take extra deductions in the spring semester, and that'll cover you for July and August. So it's not a problem. Most of the problem shows up internally, right? Because your department might say, oh, no, you don't have benefits on July 1st, or like you're teaching a summer class and you don't get benefits for summer session. You do. And we'll put out messaging and we'll ask the university, put out messaging to all departments, all grad program directors, chairs, to make it clear that your benefits as a teaching assistant or a graduate assistant on an academic year appointment extend for 12 months. Okay.
Okay. Thank you. And then if you enroll in the plan and you don't go in and make changes, you just continue on that plan.
Yep. For
Okay.
the full year.
Great.
Yeah.
Thank you.
Yep. You're welcome.
I'm glad you asked the question, by the way. It happens every year. There's a department that comes up and it's just like the department administrator or whoever is confused. I don't want to like blame another worker, but there's always confusion every year about this, that people are like, oh my God, summer, don't know what happened. So please just let your friends know too. You should be guaranteed. If someone tries to cancel your plan, push back against that because there should not be any cancellations of plan happening. And if it does, also reach out to us too, besides also reaching out with your coworkers and pushing back at your department as well. But yeah, this happens every year. It's awful.
Maybe in our messaging for the next two sessions, we can do a little bit of a summary from here. And one issue that came up was this issue. We'll get the information about that your benefits are for 12 full months, even though you're on payroll only for 10 months. Okay. But we'll also do that follow up through the administration to make sure that the word gets out. The union can also send messages to all of our members, including faculty, so that they're clear about what they shouldn't be removing you from benefits. Other questions? Okay. Jacob, do we want to go to the link that shows the plan comparisons? Okay. So we looked at this page already, right? What I'll say, I'll preface, you're going to see, I think it's 2 or 3 pages of charts here. Rutgers, New Jersey Institute of Technology, and University Hospital in Newark are the only state worker groups that have all of these choices, right? And that's not by accident. So state workers created the new plan that gave us a lower cost option, and then bargained the tiered network plan that we showed you earlier as another option that was even lower cost and has that incentive. And the unions, I sit on a plan design committee in Trenton with other union members, and we build in that incentive. So if people want the lower cost option where they have a level of security on health benefits, we want it to move people in because it's the lowest cost. So if you choose a lower option and the state is saving a lot of money because you've moved into that plan, we want to share the savings with you, the member. And so that's why that incentive is there. But we bargained at Rutgers to give you that plan, and Rutgers balked at it. They didn't want to do it, and we finally pulled in the governor's office. They came into the bargaining with us and said it was okay if we kept all of the options. And so those that are in the 15 plan and are paying a lot for that plan, but they're either comfortable or they don't want to take the risk of moving out of it for whatever reason, they can keep that plan. They just know they're going to pay more for that plan. And those that want to choose a lower cost option with a high quality benefit can do that with the new plan, the 2019 plan, or with the tiered network plan. So these plans here on the second page are just more variations of that 15 plan. You'll see on the calculator when we do that, that these don't really save a whole lot of money because they're still based on percentage of the premium that you pay. So changing the copays a little bit doesn't save a whole lot because they didn't take that big jump 2% of salary until later. But these plans are still technically available to you. But you'll see it's 2030 because the primary is $20 and the specialist is $30. And the same with 2035. Also, a word on the HMO. Don't really encourage people to join that plan because there's no out-of-network benefit. You see all those empty boxes at the bottom. And it's the same cost as the 15 plan. And so you have no out-of-network benefit in the HMO. And you need a referral to see a specialist. You get a benefit, out-of-network benefit, and no referral needed if you take the 15 plan. And any of the other options, the 2019 plan also has out-of-network, and it's much lower cost and no referrals are needed. So if it says PPO, they don't really say it here, but all those plans are what they call PPO, Preferred Provider Organization. No referrals are needed for any of them, and they all have an out-of-network benefit. Okay, so that's the HMO, and fewer people are in it. Some people may pick it because they're just comfortable with that. They know what it is, and they had it years ago, or they've just stayed in it all this time. But I wouldn't necessarily encourage new employees to go into an HMO when you get the same level of benefits, more benefits actually, at the same cost or lower cost. And then the last page, I think, it's the tiered network plans there on the left, and then the high deductible plans. So when we talk about a deductible, the deductibles here are even higher, and you don't get coverage, right, until you pay those. You can see a doctor, but you have to pay those high deductibles before any of the benefits kick in terms of the state paying the cost of the care. Okay. And I'll tell you this, there's 80,000 or more public employees in this plan. There are probably less than 200 of the 80,000 enrolled in one of these high deductible plans. You may have a reason that you want to pick that plan, but when you see the cost, you'll see that you can get a real plan at the same cost or lower. So yeah, I wouldn't encourage people to go into the high deductible plans or the HMO. You want to look at the PPOs or this tiered network plan if it works for you. One last thing on the tiered network plan, I may have said this already, or I started to. Horizon is a New Jersey company. And so if you live in New York, if you live in Philadelphia, Pennsylvania, or you use any doctors or hospitals there, they're all going to automatically be tier 2 because there's no Horizon network in those in outside of New Jersey. It's really designed to have people use New Jersey providers. All of New Jersey is not tier 1, though. There are, like I said before, Robert Wood Johnson is tier 1, and St. Peter's Hospital right up the street is tier 2. So you want to look there and see if you're seeing a doctor, go on their search, and we're going to provide those links to you to see if they're tier 1 or tier 2. Aetna, because it's a national company, has a national network. And so they do have tier 1 and tier 2 providers in New York and tier 1 and tier 2 in Pennsylvania. So that's a difference. And because they've now been added to the mix, it makes our presentation on the tiered network a little bit different. I generally would say because Omnia only is all tier 2 out of state, it may not work for you if you live out of state. But now you have the Aetna option if you live in New York or Pennsylvania or any other state. Okay. So that's the plan comparison. If there's any further questions, why don't we do that and then we'll get into the costs.
So, what are the differences between the tiers? Is it just based on location that you're living in, or?
It's not. So for Horizon, the difference is stark. If you're outside of New Jersey, it's all tier 2. But really, it's these two corporations, Aetna and Horizon, have negotiated with different hospitals and doctors to drive down the payment to accept tier 1 status. Meaning, think about it this: if I pay Jacob less than he's getting now to be in tier 1, I'm telling Jacob, but then all of our members in that plan are going to come see you. So you're going to see more patients, but you're going to take a lesser payment. So he then gets designated as tier 1. It's not clear to us that there's a quality standard there, that you're tier 1 because you're a higher quality provider. I think it was simply negotiations between Horizon and different doctors and hospitals. And geographically, you should be able to find tier 1 and tier 2 within New Jersey. I would say this is Aetna previously always seemed to be stronger in South Jersey and the Philadelphia area. And so we had a lot of members who really liked being in Aetna. But in an earlier session, someone talked about one of our grad members saying that they didn't have any issues with the Aetna network. And in a geographic area, they're required by, I think by law, definitely by the state of New Jersey or plan design, to have providers available. And if they don't geographically, there's parts of New Jersey that are more farmland still in South Jersey. So if there isn't a doctor in a geographic area that's in network, you go out of network, but it gets treated as in network, meaning that you don't have all the other higher costs to pay. It gets treated as if it's in network. And there's all sorts of appeal processes and all that. But I don't think our members are really going to have an issue finding doctors in either of those networks if you live in New Jersey.
There was
No.
a question about recording, Patrick, of whether it can be shared or not by someone who joined late.
The recording? Yes. So we're going to I don't know if we're going to take the best of the 4 or the best parts of each of the 4 and piece together a presentation. And I leave it to leadership to decide, do you want to share one of these before next week, or do we want to put them all together after next week and then post them we'd have a short time period for people to view them if we wait until after next week. There might be some value. If you're an academic year grad, a TA or a GA, that's your salary for this year. You're in year 3 of the contract. I think that goes up to 40,000 next September. These are your costs. So there's a calculator we're going to show you in a minute, and we'll share the link and you can go in and put in different scenarios. These are the costs if you have single coverage. with the academic year salary of 36,395. And you'll see that it should be identical for each of them. I do see that there's one difference in the 2019 plan. Horizon is $1 less. I think that's just a rounding difference or error, but otherwise you'll see they're identical. Because Aetna is new to the state or newly coming back to represent state workers, they've tied all of the cost mainly to Horizon's cost. And what we hope, and the unions fought to make sure we had more than one choice, or we actually had a choice and we didn't have to all go into Horizon, is that Aetna will come in maybe lower, or Horizon won't charge as much or pay as much to providers to keep the cost down in terms of competing with one another. We don't know if that actually works, but it wasn't working with just Horizon. So having Aetna hopefully will create some better choices for you going forward. You'll see that the Liberty Plus and the Omnia plan are the lowest cost. If you look on the Aetna side, that's 75% of the Freedom 2019 plan. It should be the same for Horizon, and that's been negotiated. So state workers negotiated that ratio. We won't see that plan, the Plus plan, Liberty Plus, or the Omnia plan go up dramatically because it's linked with the 2019 plan. So when 2019 goes up next year by, I don't know if it'll be 4% or 5%, the Liberty Plus will go up, but it'll still maintain that 75% ratio to the 2019 plan. You'll see that the 15 plan, which is what 2019 was negotiated based on, is over $500. What's up? $538 more per year. And so that's the most expensive plan. You'll see, I said earlier, the HMO at the bottom is nearly the same cost as the 15 or the 1525 plan. You don't get an out-of-network benefit with the HMO, though, and you have to get the referrals before you see the specialist. Again, right there, if you even thought about spending the same money, you probably wouldn't choose the HMO if you could get better benefits and no referrals for one of the PPO plans above. But again, if you wanted the percent of salary, the 2019 plan is there. And then if you're really comfortable staying in network and looking for that tier 1 doctor or hospital, the Plus is the lowest cost option, and it comes with that $1,000 incentive as long as you stay in the plan for the year. Again, the differences between these two are the networks, what doctors are available. Horizon may have some doctors that don't take Aetna and vice versa. And you can go, we're going to share links to each of their websites where you can go and look. There's like a doctor search page for each of them where you can go and look up doctors. If you already have doctors, you want to see if they're in their network and whether they are tier 1 or tier 2 if you're looking at that particular plan. If they're in the network, then they're in the network, right? You don't have a problem with the 15 plan or 1525 or 2030 or 2035. That's all going to be the same. You don't have to worry about that. And what gets covered is all the same. It's really what you pay from your paycheck and what you pay in copays out of your pocket and deductibles. And then the 2019 plan just takes that same network as all the other plans and divides it into tier 1 or tier 2. Okay, go to the next page. And then this is the calendar year chart. So again, 12-month appointment, 41,854. That's going to go up, I think, to 46,000 next July 1. So these are comparable cost, right? So I do see higher cost on the Horizon side. Jacob, I wonder if the Aetna kept the AY salary. We may need to rerun this. Those two should be the same, and they were on the previous page, but the values are probably higher because the salary is higher. So we can do that correction, but just look at the Horizon numbers and see those are what they are, and it's based on the 41,854 salary. So a higher salary, higher contributions. But again, when you see the other plans, Direct Fifth, the Omnia plan is less than half of that, right? And it's over $500 difference again for the 2019 to the 15 plan. And again, that again is state workers and our unions at Rutgers and University Hospital negotiating that we have those lower cost plan options that are real health plans. They're not student health plans, right? They're not high deductible plans. They're not plans with lots of barrier to care. They're real health plans with the same doctors, right, seeing you as they are in the more expensive plans. So let's jump to the next slide. And this is the postdoc. Okay, so calendar year postdocs tend to be 12-month appointments. This is the minimum salary, 61,804. I apologize, I don't have the minimum salary for next year, but I think it's close to 65,000. Next July 1 will be the next raise. And that'll be the 4th year of the contract. So if you're thinking about all this and the salary is going up because we negotiated it and you're now just getting here or your first year as a TA, just think about being more involved in the union and helping us as we get ready to bargain the next contract, because we don't want to see these salaries flatten out. We want to, because we know healthcare costs are going to continue to go up. Housing costs are going to continue to go up. Cost of living generally will go up. And so we want to see that our salaries are outpacing the cost of living, right? So you put real money back into your pockets and have quality, a higher quality of life. And this, you'll see these numbers should all be identical across the 2 plans. And this is single coverage. So again, if you chose like member and spouse or family coverage, those costs are going to be higher. The calculator will do a couple examples in the calculator for that. But you'll see the same sort of thing we just talked about, the HMO being as expensive as the 15 and 25 plans. The Plus or the Omnia plan is 75% the value of the 2019 plan. So this is just demonstrative and we'll go into the calculator. Your salary as postdoc might be higher than the minimums. TAGAs tend to be either or, depending on your appointment, but postdoc salaries are at least this minimum, but many of you are above that. So your cost will be higher, but again, it'll be based on either your salary for those first 2 plans or the premium on the last set. And that's beyond your control, the premium, where it goes. Okay. I think here we want to just go to the link to the calculator and give some examples and show people how to navigate it. Okay. Okay. So let's punch some numbers into here. Employee type, Rutgers, right? Annual salary. Let's do 70,000. Let's do a postdoc scenario. And let's do employee and spouse partner. And you don't have to select there. Date of hire is going to be after. Yep. And show the premium. And this will give you, again, like those 9 options. This is just based on different scenarios, $70,000 salary and spousal benefits, right? You and your spouse. And so this is what the costs are annually. For a 12-month employee, there are 25 payroll deductions, 2 per month. So even though you get 26 paychecks in months where there's a 3rd paycheck, there's no deduction. These costs are for your medical benefits and your prescription benefits. And this is the annual amount. So you can just divide this by 24 if you're a postdoc, and that'll give you your biweekly payroll deduction for your health benefits. Same for grads. You're going to pay extra in the spring because you're not on payroll for 12 months, but you're going to get the 12 months of benefits. I think you get like 21 paychecks. So you might be able to divide by that based on the annual amount. And that'll give you what it is equalized. Just know that it might be a little bit higher, a little bit lower than that amount if you just divide by 21. But we could probably piece together from members, Jacob, I'm not sure whether we can get somebody to pull from last year, some of their pay stubs from a fall semester 1 to one of the spring semesters to see what the difference is. But if we can do that, we share. But just know that this is going to be a ballpark because it'll change a little bit and you'll pay a little bit extra in the spring, but you're paying to make sure you have those benefits in July and August. You're going to get these links. The calculator looks a little bit different for Horizon, but it functions the same way. You put in the inputs and it gives you the cost for those 12 plans. Yeah, there it is. So it just looks a little bit different, but it's the same fields and the same numbers should come out for this year. They don't list them all straight out for Horizon, so you tend to have to scroll back up for the Omnia plan. But yeah, those look right compared to what we just saw. So just know if you're paying less out of your paycheck, then you're going to see that some of the copays and out of pockets are going to be a little bit higher. And that's the trade-off when you negotiate something. You're trying to figure out what's the best thing. Everybody's paying out of their paycheck. So you try to drive that down. That's seemed to be what state workers were trying to do, is that everybody paid less out of their paycheck. And then some people may pay a little bit more than their coworker, but that's because their healthcare circumstances were different and they needed to see a specialist more often or had greater prescription cost or something like that, or needs. So any questions here?
Yeah, I have a question.
Yes.
So the September 21st deadline for deciding a plan, that would be effective. Am I right that it's effective the 1st of this month of September?
Yes, your benefits will be retro back to September
Okay.
1. Yep.
So in a sense, then right now I'm deciding a plan for like the last 2 weeks or so in the next 12 months. Does that make sense?
11 and a half months total.
Yeah,
Yeah.
11 and a half months.
Essentially.
Okay.
Yeah.
Okay.
Yep.
And then if for some reason somebody didn't select a plan, would it just roll over the previous plan that you chose?
Yeah. So if you're currently a TA or GA,
Yeah.
then you're still in your plan from last year. You should be enrolled right now. If you go into your portal,
Yeah.
it should show you what your health plan is. You're fine. If you don't want to change anything, you're good. You're a continuing employee of the university, just like faculty and staff, right? So you're continuing. And if you wanted to make a change, you could just wait until October and make that change, and it'll be effective on January 1st.
Okay, thanks.
Yeah.
I had a quick clarifying question.
Sure.
You might have already said this, but I just wanted to confirm. So I was told by my department to make an election for a plan before I was aware of the orientation. I'm new to campus. And based off the information I heard, I think I actually would prefer to be an Aetna. Am I allowed to switch at this point, even though I already picked Horizon? Or
You
am I locked into Horizon for
You
now?
should be able to. I don't know if you were on when I put my email into the chat. You should go into your portal and see if you can make the change, benefits
Okay.
out. And if you can't, I'm going to throw my email back in there.
Perfect. Thank you.
If you have any problems with that, let me know and I'll reach out to UHR and to the state and see, because you shouldn't have to make choices before you have the benefit of information needed to make that.
Perfect. Perfect. Yeah, I agree. Thank
Yeah.
you so much.
You're welcome.
In the
Um,
calculator.
oh.
Oh, is there anyone? I can.
Sorry,
wait.
go ahead.
Oh, thank you. In the calculator, there's also an option for family. If I
Yeah.
choose family, I have 2 kids. The premium is for the whole family annually.
Yes.
Okay, thank you.
So I just wanted to make sure that I don't have to decline the student health insurance separately from enrolling in the state employee insurance. Does that make sense, my question?
Yeah, Nusrath might know the answer to that.
Well, you
Oh,
shouldn't
sorry,
have
my
No, it's okay. You shouldn't have to, but there was one year where I was like told that I still had to separately deny. Like I got emails from my department administrator at the same time for signing up for the state health as I did for signing up for the student health. This is
Yeah.
when I was a GA. I shouldn't have gotten that email is what happened, but I still ended up telling them that, hey, this was an email and mistake. Don't sign me up for student health. And they had still gone ahead and signed me up for student health. So just send an email just in case.
Okay.
You should not be signed up for both. And in my case, they were able to cancel one of them because I was like, I wanted the state health. So
Yeah, because I'm getting the emails where it's required to enroll or decline, and it's this is what you do for the student health insurance, but if you're a GA or a TA, this is what you do, and so that's
Yeah.
what I'm trying to do. But then it's also asking me to accept or decline the student health insurance.
But you shouldn't really have to do anything. But what we should do, Nusrath, is ask the university, have they enrolled any students, any TAGAs in the student plan who are in the state plan, because they may be paying for health benefits to United Healthcare.
Yeah,
Yeah,
because
don't
right
have
now in
to.
like my term bill, it's like charging me for the student health insurance.
Yeah, but that all should be waived if you have a TAGA appointment anyway, right? You shouldn't have any
Yeah.
student fees or any tuition charges as a TA or GA.
Yeah.
But what we don't want them is to either through fault or fraud to be paying United for you when you're not enrolled in that plan, really. They auto-enrolled you. And so we want to make sure they're actually not, because they talk about budget crises or they can't give you bigger raises and things like that. And so we want to make sure they're not just automatically paying United for you just because you're a doctoral student and then also you're getting the state benefits. Yeah, maybe we'll follow up on that one with
Okay,
with-
thank you.
Also, email your department administrator just in case too, just saying that I'm not signing up for the student health insurance, because that was the way it worked for me and for a couple other people I know on how I was able to get the student health canceled. I wasn't charged anything. So if you're getting charged something, then also we can help talk to student accounting on OneSource to see that you don't
Okay.
I think I also have the same problem, though I have been TAing for the last 2 years. Still, I have my TA contract, but I check my student and what is that bill, and there's a charge for the student insurance. But I'm already enrolled for the Horizon, and I keep receiving those emails. If you don't waive it, you have to pay the premium. And I think I was planning to send an email to Erin Jones, I think, who is dealing with this issue, but I don't know whether they already cut something from last year or not. I didn't check.
If either of you want to send an email to any of us here, myself, Nusrat, or Jacob, we can then at least have a note for it as follow-up, okay?
And if you can send screenshots of your student bill and any emails that you got, it sounds like even just between the three of us, we know there's 3 different departments and 2 different schools right now, because there's SAS and SEBS, I think, between the 3 of us who are receiving these types of confusing messages. So I think we're going to follow up to see why students, GAs and TAs are getting charged like this. Yeah, that would be great.
Why don't we jump back to the slides and run through? I think there aren't many left, and we can run through and then we can open it up to broader discussion. I think we talked a little bit about this already. Aetna has that one national network, and so there's less sort of red tape, administrative issues. And the Horizon is a New Jersey company, so they use they call the Blue Card network. So if you have a card and you're in the PPO, it'll have a little suitcase or briefcase on it, and that means that you can use the benefits in all the other states that are considered Blue Cross Blue Shield. So Empire in New York, Independence in the Philadelphia area, they have different names in every other state, and you can use them. You use those networks when you're in those states, traveling in those states. Omnia, though, only has tier 1 in New Jersey. So everything outside of New Jersey and those other networks for Blue Cross Blue Shield are considered tier 2. When to go to OneSource and when to reach out to us.
Can I take this one?
You may.
All right. A lot of times when you involve any problem at all, your department, HR, they will all tell you to reach out to OneSource. That is always the solution that they come up with. If you're looking for specific documents and paperwork, that we won't have access to that. You should get that specific document from OneSource. If you have any other issue, please reach out to us, right? I would say like being in a union means having someone in your corner always when it matters the most, right? Whatever the situation is, if you're not getting good answers or clear answers from OneSource or other avenues you've been told to take, I really just encourage people to reach out, right? Just as a small example related to healthcare, a few months ago, a grad worker called me really distraught about a email that their department sent to them about maternity leave. And first and foremost, we were trying to figure out what to do with the situation, right? Because they felt it was very insulting. It put a lot of pressure on them. So we talked about that. What do we do to resolve this like conflict? But in addition to that, they were told when it came to asking about their maternity rights, they were told to reach out to OneSource. And they sent it to OneSource, and after 2 weeks, they didn't hear anything back. And when I finally talked to this grad worker, I asked, why didn't you reach out to us? And they were told that their department said the union will escalate it and they should just reach out to OneSource. The reality is we try to find solutions that help and support you. We don't move on things without your saying so, right? Again, as part of your union, we are here to support you and be in your corner and try to figure out solutions that work for you. I really encourage, if you have any issue whatsoever, even if you think it's outside of a contractual issue, reach out and let's work on it. Just another small example of that is we're working with grads who live in Rutgers housing. They deal with heating and cooling and mold and all types of lease issues and things like that. That's outside of our purview, right? That's not with a contractual issue. However, they're members. We care about them. We want you to be able to live and thrive at Rutgers. And your housing is certainly part of that. So even just being able to bring other members together and work on and identify issues, we want to do that. If you're going to send something to one source, go ahead and include us on it. And if there's something that you're not sure, always reach out first. You have our emails in the chat, but also here, this goes to a general account. Then it gets divided out from there. But I just really want to emphasize, if there's something that doesn't seem right, go ahead and reach out. One of the biggest problems we have is people will wait until something goes from a minor problem to a crisis and the deadlines are getting shorter, and then they reach out. If you're not receiving paychecks, don't wait until September 25th. Do it sooner rather than later, and let's work on it and figure it out together. So that's why I wanted to take this one, because it's too often it's like people reach out late, and we want to solve issues and be in your corner as quickly as possible.
Not a question, but I should thank here to Patrick and the union, because when I first started here in 2022, I had a problem, and due to their visa, my dependents were not able to enroll to, and I think I was communicating with Patrick, who helped me to enroll without having an SS. And I just last week, I get an email from one source, I think. They say they terminated my dependents insurance policy again, and I now have to send again their visa, their I-94 documents again, though they know the situation. And again, it's 3 times I think it's gonna be. I have been sending all the documents as an international. So thanks a lot for all the support.
Feel welcome. If you haven't sent those, to copy me. Okay.
Yeah. Okay. Thank you.
I just want to add one thing, that even regardless of your visa status, your union activity or your like participation in the union, it's all protected. So like reaching out to us, you're not going to be getting, like, this is all legal information that we're giving to you, and us like telling you as like a union resource, anything that we're telling you here is legal. So don't be like scared to reach out to us. And if you have friends or colleagues who are like scared of the union, that like, I'm going to get in trouble if I go talk to the union, that's not it. There are many laws between Patrick, Jacob, and I. We can start listing the laws to you about why you have protections as a union member. So just tell your friends that too, especially like we get that question a lot from international students. So you should not be facing like backlash based on your visa status on that.
Yeah. I should actually say what that issue was, that our international scholars, many of them, if your dependent children are born outside of the US, then they're not eligible for a social security number. And because of our antiquated like forms and setup for health benefits, you have to show a social security number to receive benefits. So the union pressed on that and got the state to come up with alternate documentation, right? Your visa, marriage certificates, things like that, that demonstrate that you're a family and you're a dependent. And they accepted that. But the state keeps going back and doing like external audits, and they haven't updated, Masoon. The rule here is different for you and many of our international scholars. We're going to try to figure this out and make sure that they have something with the companies they contract with that show that you're protected, your benefits are protected, because they keep going back to that the SSN, Social Security number field, is not populated. There's no number in there. And I think that's why it keeps kicking back to you. So we're going to work again. You're not the first to point this out. A couple have already done it and gotten it fixed. We'll work on that. But again, the union fighting for our international scholars to make sure that you are eligible for a benefit and you can actually receive it.
Thank you.
You're welcome. Oh, here we are. So we're at the end of the presentation. There's a couple of slides at the end with additional resources, links to them. So you'll see the first one might be the most important one, join the union, right? Then the comparison charts that we went through, the calculators, the home pages for Aetna and Horizon, and their doctor search links are there as well. And so if you're getting down into the weeds and you're in the New Brunswick area, let me check my doctors and see if they're in Aetna or Horizon, and then you can make the most informed decisions there. I think the next page will have maybe Rutgers and state links on it. I'm reading the top. It says join the union again, right? So yeah, if you wanted to dig down and like when we talk about those calculators, why those what are the formulas and all that. Not all of these are formulas, but they are the charts that show like at what salary do you move into the next group in terms of what you contribute. So we just felt like as academics, you would want to know, you might want to know and dig down a little bit to the underlying numbers. And so we have those there, but the calculators will do that all for you. But we have those links. And then there's the state health benefits page on there. I think the Rutgers page is on here somewhere. Jacob, if you want to click the state health benefits page, maybe I'll talk a little bit about the dental and show you where to go to look for that. Yeah, go to review your plan choices. So I'm trying to show everybody how to get to the dental. You're going to have this link for the state health benefit program. And then down here where it says learn more dental plan providers, actually hit dental plans active employees, the next one down. Yeah. All right. And it's a very dense chart here, but this will show you a little bit about the differences. So you see the dental expense plan is like the PPO on the medical side. It's got the in-network and out-of-network benefit. And the dental plan organization, the DPO, is like the HMO. You don't have the out-of-network benefit. So you just go and, see which providers are in their network for the DPO. And so this will just show you what's covered. Benefits maximum, you'll see that's $3,000 for in-network, $2,000 for out-of-network. I think that's per plan year. On the DPO, it's unlimited. I think what you'll find is that you may have fewer options of providers in the DPO. So unlimited, if you can find a good provider in their network, then you might want to pick that plan if there's no maximum to your benefits. The co-insurance there, plan pays 100% diagnostic, 90% of diagnostic out of network. And then in the DPO, it's 100% diagnostic and preventive, less your copayment. The deductibles you see there's none for the DPO. There's 50 per person in the in-network, 100 per family. So those that have, it's you, a spouse, and 2 children, it's only $100 for the in-network on the dental expense on the DEP, but out of network, you're going to pay more. So you have this, or I don't know if we can, we'll add this as a separate link. If we can, we'll clip this and put it there with a dental heading, or we can create a slide for next week that might point out some of this information. But for those that are here, we'll make sure we add that to the resource links that we just shared for dental and get it out. Okay. Any questions on the dental? And please, Ms. Roth said I can answer all the questions. I just said if you ask the right questions. So don't ask any dental questions and we'll all be happy, or I'll be happy. Yeah, you can definitely send me any questions on dental. I'll help you with that. But any basic questions on the dental, Sophia?
Sorry, I had a question about something else.
Sure.
It's
Happy not to talk about dental.
So when we get the emails, or at least when I've been getting the emails about enrolling in a health benefits plan, it takes you to a link that details the steps you need to take based on what employment category you're in. And for me, I'm a full-time TA, or I'm a full-time TA, but that's the category that I'm in. Mm-hmm. And it tells you if you're a new full appointment to go to Benefit Solver, and it has a link to Benefit Solver, but the link does not actually go to Benefit Solver. It takes you to My New Jersey, and it took me a good 30 to 45 minutes to figure out how to actually get to the benefit selection thing. And I had to go through like the OneSource website and then to enrolling in benefits through that. I don't know if there's a way to like make that easier for people to use, but it was definitely very hard for me to figure out.
What we might be able to do, this really requires another presenter to help us and demonstrate the login process. I don't know that we can do it tonight, but maybe for next week we can be prepared to do that. Jacob and I are in the union staff plan, so we're not covered in the state. So we wouldn't have the same like access to do the enrollment, but we could try to do like a demo, or someone else who's in the thing could help with the login. We do this for the open enrollment. Sometimes there's a member on board that says, oh, I just did it. And I love this about these presentations that we do. We'll do a bunch of them in open enrollment in October, and you're welcome to come back and have more fun with health benefits. But what I love is probably here, I'm not great at checking the chat during the presentations, but I often see that you're interacting with one another and you're sharing your experiences. And that's how the union works, right? That's what Ms. Roth said at the outset, I think, that if you want to learn more about this and you want to help, like we can do this in person in a department, right? In your department, if that's helpful, right? Jacob, Nusrat, myself, others can come out, but also like you could help with that, even if it's just to organize in your department. We can do a Zoom within your department. And this doesn't have to be just this issue. It could be any issue. And that's really where the union, we don't know about problems unless members are raising their voices, right? And sometimes you'll scream. And Jacob said, don't go to one source and scream. Come to the union and scream, right? We're going to help you get that problem resolved quicker. And what I always say is like, I always thank members who raise problems because you may be thinking about yourself and how do you resolve it and get rid of that frustration. But when you do it through the union, you help everybody else because you're not the only one running into that problem, particularly with one source or on benefits, that we're then able to share that with others. And it really helps to preempt problems for so many other people. And that's what solidarity is about, is that we stand together and we help one another out. So I always love looking back at the chat afterwards and seeing how much interaction you have with each other and how you help one another. So thank you.
This thing about the benefit solver, not fun fact, sad fact is that I'm a grad fellow. Grad fellows currently do not get any of these health benefits, that these state health benefits that grad GAs and TAs get. And we're actually currently fighting with the university to get grad fellows included into our union. So if you are a fellow or if you know a fellow, please come and message me or get involved with our union, because this has been a fight for, I think, 2 contract cycles now. So it's been a long fight and we're going to keep going till we win this. But when I was signing up for the fellowship, for the insurance plan, I also had a similar issue like you, where Benefit Solver does not take you to it. You have to like go to my New Jersey and then sign up for an account. I'm glad you brought that up. We're going to try to get the next group of people some screenshots of how to sign up for that, because it definitely is confusing. So you're not alone in that experience.
Thank you. Yeah, it was definitely like an aggravating experience because I was just trying to follow like the resources I was given and like the steps it outlined, and it wasn't working. And so I was like, okay, reframing that. But anyway,
no, absolutely. And it is a little bit confusing because then what I was told when I was signing up for it like that was that like, oh, my New Jersey is tied into other things, like even that stipend that Patrick had mentioned, you have to go through there to get that incentive as well. So there's a reason why they set it up like this. It's not just because this is a statewide plan and it's not just us in Rutgers who are getting this plan. So I guess that's why they did it, but totally agree that it's a very weird system and it's just one click too many.
Yeah. Yeah. And so we'll figure out, I think there's a back door to it. Like you hit like a help button and it gives you like an alternative way to get into it. I think we figured that out last year in the open enrollment presentations. Like a member said, oh, I couldn't remember my password or whatever. And I went to the help and then they gave me like a backdoor way to get in with my like social security number or something like that. But yeah, it's not intuitive. It's like designed, I think state workers are in that portal like all the time. Rutgers has its own separate portal. So then you have to jump over to the state portal. And we can do our best to try to streamline that and maybe just be more conscientious in these presentations with that, especially for you as a first-time enrollees in the plan.
Patrick, we do have a question in the chat. What are the direct primary care doctor's office and the first responders doctor's office benefits listed in the summary for the Horizon plans?
Okay. Do you want to put up the state link again? You may already have it open. I'll show you where that is on that page. So the unions fought for direct primary care and what it is. And there's a facility, I don't know what the name of it is today, but on Easton Avenue in New Brunswick. So if you're in the New Brunswick campus, there's a direct primary care facility there. And these are doctors that have chosen to be more like employees and not have to see so many patients, right? So the typical primary care doctor in New Jersey has like over 3,000 patients that they see. And so what does that mean is that to see them all, they have to spend less than the ideal amount of time with each of those patients. So this program that we negotiated, the unions negotiated, caps the doctor's patient number at 1,000, which still seems like a lot, But what it allows you to do is go there and you have access to that doctor, which is maybe by like cell phone or text message or phone calls. And so you have more of a relationship with your primary care doctor. And this is important because your primary care doctor is, especially like for your children and whatnot, is a good way to keep from, having to see lots of specialists, right? Staying in good health. So the primary care doctor, the other added benefit is there's no transactions at a primary care doctor. There's no co-payments to pay there. You can walk in there with no money, without your wallet, without your phone and your Apple Pay. You don't need it there at that doctor. And so it's easier to get appointments, first of all. You have more time with the doctor, and there's no transactions in terms of paying anything. And I think you may be able to get limited amount of like medication. If you, I don't know, strep throat or something like that, you may be able to leave there with certain amount of medication so you can take care of things before you get to the pharmacy. The first responders is a similar pilot along the same lines, but it's dedicated to first responders, police, firefighters, EMTs, I think social workers or some state worker categories that are included in there. And so I think they've set up one or maybe two of those in the state where they can again go there and have greater access to the doctor, more time with the doctor, and no financial transactions are needed for those visits. So does that help with that? Let's see. Is there a direct primary further down, Jacob, on the screen? There you go. See it? Mm-hmm. So Everside is the one that's on Easton Avenue. It's across from the hospital, from St. Peter's Hospital. Stop there, go up just a little bit there. There are certain plans that you're not able to use. Our primary care program is available to employees, non-Medicare retirees, dependents covered under the following plans. So you have to be in one of these plans, the direct plan, the Omnia plan, the ones that we've been talking about are covered. I think so that one, the educators plan, they're for local school districts, and the Guardian State plan is local school districts. So you're not eligible for those, but any of those top three grouping, so the PPOs, the tiered network plan, and it's the plan that you can't be in is like the HMO or the high deductible plan. You can't utilize these facilities if you have those health plans. Okay.
Yeah, Shirley, go for it.
Hi, I am wondering if there's any way to get any kind of vision coverage, or I don't know. I heard a rumor that you could get reimbursed for having an eye exam, but when I tried to reach out in my group chats, no one had a firm answer.
Yeah, I've heard that too. There is no state benefit for vision. I'm not sure why the state doesn't provide any vision benefit. Nusrat, you had something to add? Maybe you have more
Yeah,
information.
actually, so you can get a comprehensive eye exam covered once a year on your medical insurance. You have to look through a little bit, but on your Blue Cross, like whatever insurance, Aetna, Blue Cross, whatever you sign up for, there will be a benefits page on there. And on there, it should say, on a booklet that you can find, where it should say that you get comprehensive eye exam covered once a year. You do not get contact lenses covered. You don't get vision, like buying eyeglasses or getting corrective lenses of any kind. You don't get anything else covered, but just one comprehensive eye exam. I've used that before. And this was on the NJ Direct 2019 plan. That was what I was signed up for. So I'm not as familiar with Aetna because this is the first time that we're doing with Aetna. But for the NJ Direct 2019, I can guarantee you because I have used it.
Thank you.
So I don't have an SSN yet, but I have applied for it like last week on September 5th. And the officer said in this additional inspection for 4 weeks, so which is longer than September 21st. And I don't think I'll be able to make it to like the enrollment deadline. Yeah.
Do me a favor, send me an email and just write up what you just said, what you know, what you're being told, And then I'll push that to Rutgers University Human Resources, the benefits person, and to the state office and ask them, in this circumstance where the SSN is coming, but it's delayed, how do we enroll you? And so it might be that they'll accept conditionally, like the alternate documentation, a visa or some other
Okay.
documentation. In the short term, knowing that you're eventually, when you get the SSN, you're going to update your forms. Okay.
Okay, great. Okay,
Great.
thank you.
Other questions? Well, I would encourage you all to share if you thought. Let me ask you this: was this helpful?
Yes, definitely.
Yes.
Yes. Yes. Thank you.
Good. So go tell people that then, right? Tell them to come out next week. You don't have to come back. It's so much fun, but you don't have to come back. But you can if you have more questions. You can send an email to any of us, and we'll put our heads together. And Mr. Roth will take all the vision benefit questions. Jacob will study up on dental, and I'll take all the medical prescription. Okay.
I just
So
want to add one thing in the end, which is that especially for the new students, I was in your shoes once where I came to a session like this a couple of years ago where I was super confused about health benefits. And then I realized that it's not that the union is just here as a resource. It is our union and it is what we make of it. And our union is only strong as we make it as members. It's how we went on strike last year. It's how we won our 32% raises in the course of 4 years. It's how we have one of the highest, it's nowhere close to living wage, but one of the highest pays as grad students in public universities around the country, such good healthcare benefits. There's definitely lots more left that we want to win. Our next contract cycle is coming up next year. We want to win childcare benefits, dependent benefits. We want to win so many more things for our grads. We want to win grad fellows representation, which is something that we're working on. But it can't happen on just me sitting in my lab here being like, hey, I'm going to work on this. We need all of your help. It's not going to happen with just Patrick or Jacob either. So I'm just going to urge you all that the three of us can go and talk to all of the people that you know. So it's not only that you sign up, but also tell your friends that this is an incredible thing that we have here where there are students who are fighting to even get a union versus we are sitting here with a 52-year-old union already with all of these benefits. So I just want to urge you all to the link is in the chat, sign up if you haven't. Our union is only as strong as you make it.
yep. And we want to be the leaders. We want to remain the leaders. We want to inspire others. And the fight is now partly your fight, right? The next contract. And so we want you to be involved. And it's a great space. Like Nusrat, our other grad leaders, Jacob, our staff, incredible. Our postdoc leadership, Andres Moreira, the VP, Trent, who works on staff with our postdocs. You probably hear these names or you've met them or you will meet them. And they're all incredible. They're all so committed to what we do as a union because they believe in collective action. And that's what we do. That's what we do day to day, right? It's not just about the contract. It's not just about the health benefits. It's about building community and working on issues. So when Jacob says we're working on those housing issues, right? It's not because, oh, there's like some trick to it. It's because it's what our members need, right? We need to have a high quality standard of living and we need time off. We need to be able to enjoy ourselves and spend that money that we're bargaining for, right? And not give it back to the boss or give it to the landlord or give it to the supermarket. We want to be able to spend that and have a great time with each other. And I've always been impressed that our grad leaders in my 22 years with the union have always thought one is about like their own circumstances, but also the future and what comes next and who comes next and building that and making sure we're always moving forward and building a stronger foundation. We're all welcome and encouraged to get more involved and reach out to Nusrat directly, and she'll share all the secrets on how to balance everything.
And Patrick, you didn't thank yourself too. We have an immense resource as well with Patrick, just working so much at the state level too. Yeah, I'm not going to be, hopefully I plan to graduate by the time the next contract rolls around. So in a lot of ways, especially for the new students, y'all will be inheriting the fight that we had set up. So yeah, please reach out. I'm also putting my email in the chat as well. Happy to say hello to anyone or chat union or just anything else that might be helpful for y'all, as especially for the new students as y'all transition into Rutgers too.
Okay. Should we call it a night?
Thanks a lot, everyone.
Yeah, thank you. Good night, everyone.